I'm going to start recording anyway, because you're right, it's getting close. And I'm sort of hypnotized by admitting guests to the meeting. So I don't want to miss it.
You're mesmerized.
Like housekeeping, I'm at Brookins in order to help this meeting meet the revised Open Meetings Act or the emergency provisions of the Open Meetings Act. And when we have a fuller house, I'll put into the chat the board packet link and also a link to the addendum to board packet materials. And if people who are not members of the board or staff of the board wouldn't mind signing in the chat, that's very helpful to us later for creating minutes, accurate minutes of who was here. So thank you. Joe, I think it may take a few minutes past 5:45 for you to have a quorum,
No problem.
because there are 3 people who are going to be a couple minutes late. So we'll see. Whichever one of them shows up first, you're ready to go.
Okay.
Okay.
No problem. That would be fine. It's what it is.
And Chandra is here and will do the roll calls and help us with that side of it.
Okay.
Thank you, Chandra, for filling in for Stephanie. It's super helpful.
Thank you.
No problem.
Hello?
Hello.
Can you hear me?
Yes, we can. Oh, I can anyway.
Yes.
Okay. Joe,
Yes.
you haven't started yet, right?
No.
Yeah, okay. I'm calling in from Texas. I'm out here for some family business. And
Okay.
I'm just going to warn you that I have got to leave at 7 o'clock.
Okay. So we kind of know that we have a full docket and we will not finish it all tonight. We'll try to get as many as done tonight as possible, and then hopefully next week we'll get the rest done. So, and we'll be starting a few minutes later, and we're going to do some front loading of some of the things that we do in the back. So.
Right. A bunch of people got stuck in the waiting room. I didn't see them until I closed it and reopened it. So this is odd, and I apologize. That's making it take even longer.
I've never done this on my phone before, so I don't know quite how it's working. It's slightly disorienting for me.
Yeah, it's working. It's working. It's the phone makes it a little bit small.
Yeah. Well, I can only see one person at a time, but
yeah.
Someone else just entered the meeting by telephone. So I'm not sure who it is, but it's a 217 number.
It's possibly that I've done it twice.
Is
That's
it?
possible. Because I was a little bit disoriented when I first came in.
Oh,
Well, we'll assume.
Does
Hi,
it
guys.
identify the number? Does it identify me?
No, is that
Yeah.
Sam Banks?
Oh.
The
yep.
number
Hi,
is-
hey,
it
Lynn.
is
I
you.
just jumped on.
Okay, Sam,
Hey, sorry. How's it going, guys?
Are
it's
you
going well.
the one who called in from 217-898-7327?
Nope. I'm on Zoom wise. So hopefully, yep. I'm actually in Arizona, so I'm hoping
Okay.
we stay connected here.
So we have everybody all over the place.
Yeah, that's right. Coming in from all parts of the United States.
That's right.
Appreciate y'all coming and being here for this meeting. This is a really important meeting to us. We're just waiting for one more board member to come and then Joe can call the meeting to order. I'm sorry if I'm shouting.
You don't sound like you're shouting, don't worry.
I think this is it, Joe. I think you
Got a
have,
quorum?
in just a couple seconds, I think Dr. Joachim will appear and that's
Okay.
your quorum.
There he is. He's here. Okay, let's have a call to order. Roll call, please.
Okay, we're calling it order at 5:48. And the roll call, Susan Fowler. Elaine Palencia.
Here.
Kyle Patterson. Julian Rappaport.
Here,
James Sprandel.
Here.
Jean-Paul Joachim.
Here.
Joe Omoasagie.
Here. Okay, is there any citizen input right now? Do you want to check the hallway to see if anybody's out there?
I'm very far away from the hallway.
Okay.
There was no one there when I looked before.
Sounds like a plan. So let's
you
just
for
assume
making-
there's no one there. So let's move on. Let's move to approve the agenda. I suggest move a motion to adjust for the agenda.
I make a motion to approve the agenda.
Is there a second?
second it.
Thank you. So you have to roll call with this. Do we need a roll call or we just move on?
Yes. Elaine Palencia.
Yes.
Kyle Patterson. Julian Rappaport.
Okay, yes.
James Sprandel.
Yes.
John-Paul Joachim.
Yes.
Joe Omoasagie.
Yes. Okay, just quick comments. We have a full docket today and things have been happening in our nation. Things have been happening locally here also. And hopefully we are part of a solution as a mental health board and all the mental health workers within the community. We'll make things happen, hopefully. Thank you. Executive Director comments?
I'll keep them really short if I can. I wanted to share that I've put into the chat the link to the board packet and then also a link to addendum to the board packet. And it includes only corrections of staff errors in the program summaries. And they were all related to family service. I am so sorry. So those are available in the links. We have also gotten a great deal of input, feedback from the agencies about clarifications or elaborations on the original application, answering some of the questions that we wrote in there. And that information is much appreciated, and we will use it after the board makes decisions about what to fund. We can give the agencies an opportunity to fix errors or add some of those clarifications. Those are not included as a separate packet, but if you happen to have questions along some of those lines, I think everyone is ready to answer questions. There were two things that happened in these program summaries that I want to assure everyone are not to worry about. One was the eligibility questionnaire. We have found that some of these are 10 years old, and in a couple of cases, they were completed by an agency that's no longer in business. That was, you know, because of the result of a merger or acquisition, is now represented by someone else. So in fairness, they should have the opportunity to fill out a whole new questionnaire. What's happening too is that these are old and contain answers that are no longer true. So we have a difficult time with figuring out if there are compliance issues. So what I've learned is our system isn't working very well because that document is so old. So sometime before February, we will give everyone an updated eligibility questionnaire to complete so that we can understand everyone's current state, not 2011 state. So that's more important to us than to anyone else. So sorry that if it caused any distress. The other issue that might have been concerning to some is regarding the selection of a PY22 priority. So it wasn't supposed to be possible to select an old priority, but our developer has discovered that you could. So he has fixed that, and it's very easy for us to get everybody caught up to select a priority that matches, you know, the PY22 documents. So anyway, that's it. I should stop talking so that you can get on with business. There is I've been working on the budget, and there does appear to be a very large gap between what is requested and what is likely to be available, like over $700,000. So I'm also working on other ways we could build the fund. So more on that later.
Yes. Yes,
Anyway,
let's-
thank you.
thank you. We'll move to approve the minutes from the Mental Health Board March 17th meeting. Is there a motion to move on that?
I will move that, Elaine.
Okay, is there a
I will
second?
second. I'll second.
Thank you. Let's vote on it.
Okay, Elaine Valencia,
Yes.
Julian Rappaport,
Yes,
James Brandel,
Yes,
John Paul Joachim,
Yes.
Joe Omoasagie.
Yes. So since we're up front loading most of it, we'll take a look at the expenditure list.
I've given you the wrong board packet. I'm so sorry. I need to get the right board
okay,
packet.
no problem. So while you do that, the expenditure list is a suggest to move to approve the expenditure approval list dated April 9th, 2021.
Yes, I'll move to approve the expenditure list.
second,
Thank you. Roll call, please.
Julian Rappaport,
yes,
James Brandel,
yes,
John Paul Joachim,
Yes.
Elaine Valencia,
Yes.
Joe Omoasagie.
Yes. Okay, now we move to the,
Susan Fowler is now here, by the way,
okay, thank you, Susan. Thank you for chiming
and I
in.
vote to approve.
Thank you, thank you. Thank you for chiming in there, thanks. Now let's go to the new business. We're going to review agency requests. For those following at home, or it starts on page 18. And the first agency request is for CCRPC, the juvenile diversion program. And I think it's been reviewed by Palencia and Fowler.
Yes. So I'll begin. This is the Justice Diversion Program that this year has funding of $75,308. And for next year, they're expanding their coverage. This is a program that has served individuals and families with justice involvement. That would be a domestic call by the police, a crisis intervention team contact, like activities of that nature. And it has been for Rantoul, and now it's going to expand to cover the jurisdiction of the Champaign County Sheriff's Office. So they're now asking for $207,948. And so it will include other rural residents, and that has been in recent years a focus of ours. In addition to other underserved populations, we have brought our attention to the rural populations that have had trouble getting service. So the aim is justice diversion, that is to reduce the repeat calls to law enforcement. And so this program will be doing service referrals. They'll continue what they have been doing, but over a larger area. And I think this is the fourth year of operation. So they are certainly a known quantity. And they have already, I believe, I'm looking at the data now. They are doing, of course, some adjustments for the COVID problems, but their community service events are up, but down on some other numbers. It's just so hard to try to understand, how that's affecting contacts. And I think the only thing that the staff noted is that there's been will there be a workforce issue with expanding it? Otherwise, it's done a good job with their cultural and linguistic competence and with the outcome for the families. They link them with a variety of services that would impact certainly our mental health issues, and have done a good job training staff as far as I can tell. So I don't see any big issues except just the one of workforce, which seems to be everybody's issue. Susan, do you have something else, other things to say?
No, I agree with everything you've said. I think it's a good proposal. And the only thing is, it's an expansion, and whether or not that is within the budget for the board, and whether or not they can identify the workforce and hire them, we won't know until they have the opportunity to try. Great summary.
That sounds good. We're not making a vote on it tonight, so, but yes. So, do you have any questions? Go
I
ahead.
had a few questions and comments. I agree, like, it's a good program from reading the description, transitioning from making everything a nail, when a police department is the hammer, it's nice to have more than just a hammer in your toolbox. I was surprised. I was wondering, I don't know if other people know, do police departments have social workers or police officers that are trained in social work on their force in the county, like the Champaign department or the Urbana Police Department? I don't know why it requires the county mental health board to fund these things. Why can't the police departments request funding from their municipalities or the county directly? Because this is going to reduce, the amount of work that the police has to do overall, because it's decreasing repeat calls. So I would think that'd be something that you would want to invest more in. The other thing is, I wasn't sure. Wait, where is it? Oh, I wasn't sure why there's a high turnover in the program. Is it just because people are burning out? Is it just a very demanding field, or does the pay need to be increased? Or I wasn't sure what it was.
Would you like me to answer those questions, Lynn? Is that where we are with this?
No.
Sorry, okay.
So not this week.
Okay.
Okay. I mean, those are part of questions that you can put and start sending us information about.
Joe, I think it would be more time. It would be better use of your time to allow the answers to questions now.
Oh, okay.
The other way, we might even need to have an extra meeting.
Oh, no extra meetings.
Yeah, I mean, it's just very time consuming to send out letters waiting for replies and then get that all to you.
Okay. So Lisa, do you have a quick?
Well, can we wait till we finish our conversation before people start answering questions?
Oh, okay. You have more questions? Go ahead, Julian.
I guess I need to know from Lynn what this increase from 75 to 207 means in terms of our resources. I'm sort of independent of whether or not this is a good program, and then raising the question that John just spoke of, which is, well, what is the municipality putting into this? How does this size increase affect, given that we only have finite resources?
Mm-hmm.
The reason I said no to asking to people to respond to questions is because I actually don't know how to process this given those questions.
Mhm.
Maybe Lynn has the answer that I'm looking for. I'm not sure.
Well, if I could just say, if you look at the application online, there is a variety of federal, state, and local granting that supports this program as it. So there are other sources, whether they are going to ask, from those sources in the same way, I don't know, but you can find that online about the
So
other.
I thought this says that the request from the mental health board is for 93% of the total revenue. Do I misunderstand that?
No, if you look at the whole program, Julian, if you look at the application online, there are other funding sources given. That's all I was saying. I mean, if you would like to see the whole picture.
Actually, I want to hear what Lynn has to say to what I asked.
Well, this is a really big question. The money that it looks like we will be receiving this year and next year doesn't give us a lot of room. We over budgeted last year on purpose because we were at the beginning of the COVID crisis. We used fund balance to do that. The fund balance is now, if we continue at the current level, we're going to shrink the fund balance down so we're not sustainable. So I'm looking for other funding.
So
Getting desperate. And I'm seeking other funding.
okay, so maybe I'm asking this question now because it's the first one we're talking about, and there's a significant increase requested, and I'm anticipating this won't be the last time that question will come up. So what I'm and if we're planning tonight to vote yay or nay on each program,
No,
I mean, it's one thing to approve the program because it's fine. It's another thing to ask, how much are we committing to pay for it? I don't know how,
Well,
are we
so
separating those two questions?
typically what you do in May. I will try to bring you an affordable set of recommendations. And I think this year, because of the extreme shortfall between requested and available funding, I've already done the budget a few times. I'll do it again tomorrow. But I think that we'll need to employ multiple strategies. You know, one strategy is if you are funding a bunch of new stuff and cutting a bunch of current stuff, you have to think about like people's jobs and who's being served currently against the value of an innovation that we really want. You know, so I think we're gonna have a few different strategies, some to control the cash flow, like fee for service. Contracting allows us to control our cash flow a little bit better. I don't like it for other reasons, but I think we need to use a bunch of strategies. But my favorite strategy right now is to find additional money.
Yeah, I mean, that,
But you
How
don't have
much-
to make decisions tonight at all.
yeah, so we're not making the decisions tonight, but I mean, as Lynn mentioned in her executive report, we are looking at over $700,000 in the hole. And we can't make all those decisions right now. And then we can go draconian and say, okay, everybody gets 10% off or things like that. And that's not what we're trying to do out of this moment. So we're having this conversation so that we can really look at all the programs and see where the shortfall is. And also, Lynn, I know in our conversations is looking at other avenues for more funding, but we don't know about that yet. And so until we know, and we have probably a month to make that decision, we will still be, lots of agencies are asking for more money, and we'll deal with that as we go along. We just want to hear what the programs have, and then we'll go from there.
Can I make a statement or add
go
a
ahead, please.
comment? Thanks,
Go ahead.
Joe. This is Susan. We've never made decisions on the first discussion of the programs. So, but in the past, we've submitted questions for the agencies to respond to. And I think what Lynn was suggesting today, that if it's a very quick response, like a yes, no, or 60 seconds, no more, it might save time to get those responses. But we're pretty far away from making recommendations on how much to fund or anything like that. Today, we're really summarizing the programs and raising questions that need to be answered, whether it's today or in responses provided back by the agency.
Yes.
Thanks.
Yes, thanks.
And then I have a quick note, kind of bounce off that a little bit. I think we're going to see in many of these proposals where if they're wanting an increase, especially if it is in regards to staff, I think that is something I think John had said, is the staff, are we going to have a workforce issue? And my fear is, and we've seen this in past programs, we fund so something to think about as we go forward on many of these. So thank you.
Yeah. So Champaign County, we sometimes have a workforce staff issue around here. And people move around quite a bit. Okay, we'll move to the next item on the.
I would like to request again that we let the agencies answer questions.
Okay. Yes, go ahead,
because
Lisa. Do you have a quick response?
Yes, I do. You can start my 60-second timer. Ready, go.
Go.
So police department, have they employed positions of this type? At this current moment, to my knowledge, Rantoul Police Department does not have any human service social work positions in place. Historically, over 20 years, there have been different points where I am aware of my previous work that they have employed domestic violence specialists and things like that. But at this moment, this is the position in Rantoul. With Champaign County Sheriff's Office, they do not fund a specific human service or social service position at the Champaign County Sheriff's Office that they employ. High turnover and staff turnover. We have indeed had staff turnover in this program in Rantoul. Over the 4 years, we have had 3 individuals, very talented individuals. The one most recently, we knew when we hired her that she likely would move on to greater things, and we wanted to harness her talent while we could, and she did a wonderful job, and we're happy to do that. We always weigh the pros and cons of knowing that we're going to hire a very talented individual that may move on. The first person that started with this program, again, go getter, and actually that person has just literally come back to the work that we're doing in our Justice Initiatives team. So for about 4 years ago, she did this position, and now she's come back. She's hired into a coordinator role, and she will be working closely with this team. So we have indeed had staff turnover. We see that in social services, and I think I explained that a little bit. So I think those were the primary questions to answer.
Okay.
Thank you very much. I appreciate it.
Okay.
So I want to make a quick comment about the question of turnover in a position like this, and also acknowledge that this is a co-responder model. I think it's a very stressful position, dealing with very intense situations. So the staff that work there, I think, really endure a lot. And, I appreciate the people who are able to, still, keep coming back and have the energy to take that on. But I think it's pretty understandable that that type of a role, you might see that sort of turnover. And really, even in law enforcement itself, there's a pretty high turnover rate.
Yes, it is. Been on the ground there for a while. So let's move into the next one. It's Elaine and Susan again, the Youth Assessment Center.
Yes. Before we move on, I just want to say that one thing I liked about the Justice Diversion Program was a stated commitment for collaboration, that they say they want to lead the way in bringing different agencies to bear on these issues. So I like that very much. And their application has a list of agencies they have working agreements with, as does the YAC, the Youth Assessment Center, which is our next proposal. And it, like the first one, is one of the community service agencies of the RPC. And it is the YAC is very much a known quantity to us, and they are requesting $76,350, which they did last year as well. It's kind of has been a stable amount. And they serve youth from ages 10 to 17 who are experiencing, are seen as moderate to high risk to become involved with the justice system. And they have a good assessment tools, and this has been around quite a while for us, and to again divert youth from the justice system. And there was something about a deficit that I didn't understand. Lynn, where are you? There's so much underlining, I can't. And see where that is right now. But they also have, I think, been impacted by COVID. The numbers are down, but we would assume that that's what has happened there. But they partner well and are reaching out to the rural areas, and they work with the sheriff's office. I don't know, I can't determine if there is some overlap with with the justice diversion program at all? I don't think there is, but there are. No, Lynn shaking her head no. That was one of my questions. Because that's something that historically the board has always looked at for, for unduplicated service. So that's a good thing. Susan, do you have other things about this program?
No, just that the reviewers have noted that because they weren't able to serve as many people as typically due to COVID, that they may, if the utilization continues to be low, need to have more virtual services and a way to shorten the time frame from referral to assessment, which I think is a challenge for many of the programs that we're seeing.
Yeah.
Any questions or comments? So if there are no other questions or comments, we'll go to the next one.
Okay, I think I have the next one, which is the Children's Advocacy Center. This is a program that we have funded for a number of years. It provides services to families for whom their children ages birth to 17 have there have been allegations of sex abuse or physical abuse, and the program is geared to reduce trauma and PTSD for victims of abuse. They serve Champaign County. They also have provision for Ford County, but when we asked, they really are not using our county funds for Ford County. So primarily it's Champaign. It aligns with the crisis response and intervention and systems of care for children and youth. It very much reaches the rural areas. It had 185 participants this past year. They use evidence-based forensic interview techniques and trauma screening. They do have a logic model and a way of measuring outcomes. They have great evidence of coordination and collaborations. They have grants, and they also receive funding from the United Way. So they've remained open throughout the pandemic, and I would actually recommend in the future that this be a 2-year funded cycle because it's been so consistently reliable. That's all I have.
Do you have anything to add, Elaine?
No, I thought this was a well-presented application. I was the one who asked about the relationship between the Child Advocacy Center and CASA to get that straight. And so the children served by CASA, as probably everybody on the screen knows, but me, the parents have lost those children due to an abusive situation, and so that is in the legal system. And this group here, there still is family involvement in the support system.
I don't think CASA's involved at all unless they're referred. So it's pretty separate.
Yeah, it's and there's a very clear paragraph. We asked that question, and there's been a very clear answer from CAC, which is in our packet.
Right.
Okay, John.
The only question I had for the applicant was why are only 80% of forensic interviews upheld? Is it because the child has developed a delay, or autism, or is it just due to the young age of the child being abused? If these are trained interviewers, I'm just wondering why it's 80%. Is there a reason for that?
Is there someone that could answer from the agency?
She's here.
Sorry,
There she is.
I was trying to unmute my mic and it wasn't working.
No problem.
So 80% of the interviews being upheld. It's really hard when a case goes to court and it's a jury trial for jurors to find someone guilty when there's not physical evidence. And a lot of times by the time a child discloses that they've been abused, there's no longer any evidence. A lot of times kids wait until they're in a safe place, and that could take years. Or they wait until an age where they're comfortable to talk about it, because it's a really hard thing to talk about. So we've had some pretty major cases where the jury has found the alleged perpetrator not guilty because it's really just an uneducated jury.
So I think I misunderstood the writing here. When I thought it meant, when you meant upheld, I thought that meant admissible in court versus actual conviction.
Well, yeah, but the term that I put on there, I meant for both. That's how we counted it.
Okay, thank you so much.
Mhm.
Okay. Any other questions or comments? Okay, so move to the next one, which would be the Champaign County Christian Advocacy Center. Oh, the Champaign County Christian Health Center, mental health. That would be myself. So the looking at funding, and the funding increase is it's 33,000, but it's a funding increase of from 13 to 33. The target population is the underinsured in Champaign County. I wish, really, in my wish, that this did not exist, that we had carte blanche, that everybody could get mental health services, not just mental health services, but just health services for everyone. But it's usually one of three most common diagnoses. I mean, having anxiety and depression and those different things. They have established some satellite clinics in Rantoul and also at OSF. As of in residency, 98 were in Champaign County, and as of this time, this report was made, 30 were in Champaign. I think it's from all that I see, it's a program that keeps doing what it says it's supposed to do. However, we keep my it's an increase of almost 153, 100%, over 100%. So we are looking at another increase in this for funding. They are doing some collaborative work with several other agencies, trying to get some different monies to help with this, with support for this. But it's an increase, but it's still not as large as $100,000. So that's a good thing. Do you have anything to add, Jane?
I really agree with what Joe said, and I think especially in the last 15 months or whatever, this need is only growing. Again, my biggest concern would be the fact that it is an increase and we just potentially don't have that extra money. But it might be one of those things where if we see some other collaboration, it might be, this is a good choice. So potentially, if this is something the board likes, I think this would be a great program for a 2-year agreement, just because like Joe said, they have done what they said they would do plus more. They're really trying to serve even more than they thought they could. So.
Okay. Any questions for us or for
I would just comment,
Julian?
I just, if I understand this correctly,
Mhm.
well, the increase is large in a percentage basis, but on a dollar basis, it's not
Yes.
gigantic
Yes. Yes.
relative to all the other things we
Yes.
fund. But that's
Very-
an aside to what I was going to say. If I'm reading it properly, I think that the mental health board would only be funding 25% of
Mhm.
their program this way. So they have, the other 75% come from other sources. So that's a positive, I think.
Yes, it is a major positive because we are always asking for interagency collaboration or finding monies from other places, and that's a great thing that they are doing. Any questions or comments?
I will add on that this is definitely an agency that much of their services are dependent on if they can get the professionals needed. Because obviously these are professionals that are needed, not just lay people like myself.
Okay, Lynn?
Jane said it. I think they
Okay.
made the case very, very clear for what the increase is meant to cover. Just 'cause they lost their office space, so that's one big new expense. And the other is, as you said, Jane, we need to pay for one of the professionals a
Mhm.
little bit at least.
Yeah. Thank
Thank
you.
you.
So any other questions or comments?
The only thing I would add in is I was wondering if maybe they'd be interested in like coordinating or collaborating with the Champaign County healthcare consumers to get those patients signed up for Medicaid or assistance through other, like the Carl Financial Assistance Program or the OSF Assistance Program, to get them resources in case they can't go back to the Christian Health Center for some reason, or at least then so that they can get reimbursed for some of their services that they provide if they do have a psychiatrist or psychologist, so then they can run that through like Medicaid insurance. Even if it's a little, it adds to your funding. And so maybe if they send those people to Champaign County healthcare consumers, they can then get them signed up for those services. That was just, yeah.
Yeah, oh yeah, definitely having one of the ACA navigators help them out to make sure that it's not just all that they have, but yeah, okay, get in here. That's a good idea. Is there anybody from the healthcare, Christian Healthcare Center out there?
Yes. Thank
So,
you. Hello, everyone. My name is Jeff Trask, founder for the clinic. Just to address the question there, we generally see the uninsured only because we see folks who have nowhere else to go. And then we also see the underinsured in the context of people who have deductibles that are way too high. And so they basically are uninsured for all practical purposes. Anyone who is eligible and can get Medicaid, we definitely, get them signed up and so on and so forth. But there are various pockets of people for any number of reasons that are either uninsured or underinsured still. Whether it be undocumented, whether it be transient, whether it be, refuse to participate in state exchange. I mean, there's a host of reasons why you have these pockets of people who still fall into these, fall between the cracks. And that's what we make sure we try to cover. The other issue with us is that if we try to bill, then we run into complications with legal issues. We have very strong protections of being a free clinic. And we have both a federal and a state level protection because of that. So we would be sacrificing that if we were to try to go into any kind of billing type of structure. And as you mentioned, if we start billing for Medicaid, we're still talking about 33 cents on every dollar, and take a year to get that, even if we go that route.
okay. Thank you for clarifying. Thank you. Okay. If there are no other comments, let's move to the next one, which would be the Champaign County Head Start Early Childhood Mental Health Services.
There you go. All right. So I think I'm the primary on this one. Yeah. So the early Head Start mental health service program is requesting $326,369. And so they are funding 4 staff, 1 part-time early childhood mental health consultant and 3 full-time social skills and prevention coaches. Funding for the 4th coach was secured through an ISBE grant. But it didn't state whether that grant was going to be recurring or how long it's for. So that was just one question I had. And then, the social emotional developmental program collaborates with parents and teachers to identify the needs of the children through assessments and observation. They help them create goals and plans of action for the children to develop interpersonal skills. They develop support plans for the children with challenging behaviors like oppositional defiant disorder or ADHD, probably most likely is what they encounter most in those age groups. They also facilitate workshops, support groups, and coaching for parents and staff on social emotional development. They work with many of the organizations in the area to provide additional services for those children identified as needing intervention, but have not yet met with specialized professionals. They provide evidence of strategies they are using, evidence-based strategies like the practice-based coaching that uses teaching practices that lead to positive outcomes. They also use the pyramid model, which is also evidence-based. They use social emotional service delivery model, which is based on the Illinois mode of early childhood mental health consultation. And then the coaches all have bachelor degrees in either health education, sociology, or psychology. One is board certified in behavior analyst, and the mental health consultant has a master's in school counseling and a doctorate in counseling education and supervision. Services are provided at sites in class all across the area in classrooms and homes, community settings, or virtually, which has helped reach rural and low-income families. They have to maintain at least 10% of enrollment for children with a diagnosed disability. So this helps target children with special needs. In regards to the anti-stigma, they state that the Head Start takes seriously the need to reduce the implicit bias in their staff and impact of structural racism for their families, but didn't say how they accomplish this specifically. Children are eligible for services funded by the grant if they score above the cutoff on the ASQ screening, which is the Ages and Stages questionnaire for social and emotional development, or the Social Emotional Committee identifies a child, teacher, or parent needing additional support. The average length of service ranges between 3 months and 2 years. They help to improve self-regulation, emotional literacy in children, improvements in parental stress management and caregiving skills. Most of the budget spent on occupancy, which is indirect administrative costs for support, equipment, furniture, insurance, and overhead. The rest mainly goes, 54,000 goes to that. The rest goes mainly to salaries of the professionals, and that's the main cost. So, yeah, I mean, this has been a program that we're currently funded, and it seems like it's a very good program because right now, these children are already in the Head Start program, so they're getting early intervention to get them up to speed for kindergarten. A lot of these kids do have behavioral issues that if they don't get good control now, they may have a really difficult time learning academically and progressing to where they need to be ready for kindergarten. And so I think it's an important program because it deals with the very first few years of a person's life, which is what we're doing. So I don't know if Susan, if you had any other comments.
Just that this year they've combined what had been separate proposals. And we asked them to, and they did that. So it looks like a larger proposal, but it's a request for the same staffing pattern as before. I did ask them what other sources of funds they might be able to draw on. And they responded by saying that they had additional funds this year related to the CARES Act and some other sources, but that it was desperately needed for other issues within Head Start. So they appear to have access to known other Head Start funds or agency funds other than what they're getting from the Mental Health Board, which would jeopardize, without those funds, the delivery of these services. But I would like to encourage the organization to try and tap into additional sources of funds if possible in the future, because it's a great program without any question. The request is one of our higher requests, but it's a great program. Thank you.
I think hopefully the CARES funding is wrapped up, but then the new funding from the bill that just got passed, hopefully there is some extra monies in there that they can tap into also. So any other questions, comments, or answers to any of the questions that were raised?
I can answer if that would be helpful.
Okay, go ahead.
Thanks. John, your question about whether the funding for our fourth coach is recurring, and yes, it is. It was built into part of our early Head Start expansion, and so that gets kind of every time we apply for it, we would get that again. So that person's role isn't going anywhere, and would be outside of the money that we get from you guys.
Okay. Thank you.
Excellent. Awesome to hear.
Okay. So if there are no other questions, let's move it on to the next one, which should be the Champaign County Healthcare Consumers.
Okay, so that's me. Can you hear me? I just never can tell on this little phone here. So this is one of our creatively developed programs locally. I don't know that there are other programs like this in the country, but this one has been going for quite some time, and they pretty reliably deliver help for the people who are probably the most needy in the community. And what they managed to do with the aim of this program is to get people the kinds of benefits that they're entitled to. So they do things. We had a pretty interesting presentation actually from Claudia earlier in this year, in which she kind of rapidly went through describing the many different things they do. And it ranges from, they just reach out to all kinds of people who are needing assistance and help them get through the forms and the applications. And in the process of doing this, they discover, and their estimate is 35 to 40% of the population that they're dealing with have significant mental health issues. So they might not necessarily be people who would self-identify that way, but through this process of really a helpful and not necessarily psychologically threatening, they develop a relationship with these clientele. And they help them get things like additional case management, and how they've managed to continue doing this during the pandemic is a slight mystery to me. Although I think they do it through the way other agencies do, also through telephone and other indirect contacts, although they seem pretty persistent about this. And what they're asking for is a very small increase. I think, what is it? They're asking for $80,000 for this program. I believe they had 77 last year. So it's a small increase. I think it's one of these programs that has been proven to be quite useful to the most needy population, and it's relatively speaking pretty low cost. I believe our funding covers a little bit more than one FTE, and I think this is exactly the kind of pretty consistent program that we ought to consider putting on a 2-year contract. But that's really all I have to say about it. I think we got such a terrific report of describing the details. I don't want to repeat everything that was recently said. So let me just stop there and see if who else is reading this.
I am, Susan. So I agree with you, Julian. And the other thing that is really notable about this program is how much they coordinate with other providers,
Yes.
you know, extensive coordination. And the second point is that without mental health board funding, it might not exist because they have sought other funds in terms of grants, but we do provide the majority of funding for really quite a bit of bang for the buck.
Right.
Yes. So, any questions or comments?
Just wondering how much money we could save if we had universal health care.
Oh, don't push that.
But yeah, I don't have any questions.
Okay. If there are no other comments, let's move to the next one, which would be the Champaign County Community Services Center of Northern Champaign County. No, that's not it. Justice Involved.
All right, I was the primary reviewer for that one. To avoid parroting almost literally everything Julian just said, I mean, this program is this, you know, it's also the community health worker, but it's focused on people who are justice involved. So it's a program I think most of us are pretty familiar with, doing essentially the same work that Julian described, except for they're taking referrals from Rosecrans, people who are referred through the jail, and they do walk-ins as well, but I think primarily we're looking at referrals through the jail. You know, this is really an incredible program. Navigating the system, you know, many times is the biggest hurdle for people. And you know, as Julian made reference to, it's not, you know, simple to get funding for this type of thing. And you know, I think that with our flexibility, you know, it's great that we've been able to keep something like this afloat. But yeah, I mean, when you're talking about, you know, helping people get benefits, I mean, even if they aren't dealing with, you know, cognitive issues or mental health issues, the system's just, it's confusing and it's defeating for people who are, you know, dealing with and experiencing trauma. So I think this is a really, really vital program. Increase of 3%, pretty similar to the other one. That's mainly covering personnel costs, but yeah, I mean, that's like I said, is pretty familiar with this. That's pretty much all I got.
Thanks, Kyle.
So I'm the second reader of this one also, but I won't repeat myself or Kyle. But I will say that this is just maybe I don't know if this is an aside or not. It just feels to me like this is the kind of thing that because we have a mental health board that can be flexible and not necessarily required to only give money for people with specific diagnoses, navigating the healthcare system and the mental health care system as together is so sensible that we're fortunate, I think, to have the flexibility to look at agency like this that does that and does it at a reasonably inexpensive price. So the difference between the first program and the second program is that this one focuses on people who have specifically been involved in the criminal justice system, and that adds another layer of difficulty for people.
Yeah. And as an add-on, I wish we didn't have to do this. And I wish we had a system to just, okay, well, whatever.
Yeah.
I'll move to the next one. This disability services, it's a new.
I think Lynn has a question
innovative-
or has a
Go ahead.
comment.
Go ahead.
Is it okay?
Joe.
I'm sorry, Joe. Thank you for keeping things moving. I just want to add that there are some projects in this portfolio of applications that have a lot of meaning to other units of government. So I asked those other units of government, how's this going? And the folks who run the jail love the person who does this work there. So they're very, very pleased with this service. I just thought I should tell you that. That was after we'd finished the program summaries. I had a conversation with her. Thank you.
Okay. Would they be willing to fund part of it? Just saying. Okay. Any other questions? So, Elaine, were you about to ask a question? So, like,
No,
oh, okay.
no.
Okay. And the next one is the disability services, and it's a new and innovative accessibility.
So this is essentially doing, as I understand this proposal, it's to essentially do the same thing, but with substance now being to help people with identifiable disabilities apply for the kinds of supports that are available to people with those disabilities. And it's a very complicated process to get SSI and SSDI, and it's just really difficult for people to do. And so this is essentially wanting to use their experience and focus to help that specific population of people. The only question I came away with is with this as a new proposal, other than in the question of whether or not we want to take on any new programming, but that's just a more general question. But to this one specifically, and I don't know who to ask this to. I guess I'm asking it to Lynn, but what do we think? Why isn't this showing up as a DD board proposal rather than a mental health board proposal? Or why don't we have some idea about maybe jointly funding this kind of thing? So that's my question.
This is Susan. Do you mind if I give a
Go ahead.
preliminary response?
Yeah, go ahead.
This focuses on mental illness and substance use. So, so it's disabled due to mental illness and it's usually and substance abuse. So it's not individuals who are developmentally disabled. And it's really hard to get SSI or SSDI if you don't have a clear disability. But mental health is a disability. And I think that's probably why it came to the mental health board. But I think that the question of should it be co-funded with the DD board is very reasonable to ask Lynn. But I just wanted to really focus on its substance abuse or substance disorder use and mental health issues, not DD.
Okay.
And I was a secondary reviewer.
Okay.
That's
So
all I can
it's
say.
not just with a dual diagnosis, but it's looking at that aspect of it.
It wouldn't work because eligibility, DD eligibility has to be determined before age 21, and the DD board doesn't fund anything. That, like, all of that would be handled earlier in life. And the process for these disability determinations, as Susan suggested, is really different. I've worked on SSI and SSDI applications in a previous life, and it's hard to get SSDI determination for a person with DD, but it's almost impossible for these other, I mean, literally they'll tell you things like, it matters how thick the stack of paper you send is and how many times you appeal the decision. So it's, but it's also like, it wouldn't be done the DD board anyway. Like it would pass the point where people would need that type of support.
So then there's probably, I'm sure embedded in this, that response is something I don't understand, which is why does this require a third program? Why doesn't it just get taken care of by expanding, if necessary, from the two existing programs? I'm a little confused about that.
Is it, Kyle, were you going to answer that? Do you know that? Because I think that it's there's a specific training behind this. There's a fast track for SSI and SSDI applications for people who are at risk of homelessness, and it's called SOAR. And it's a specialized training. And I know Kyle works with somebody who's had that training. So I think that's what's behind this application, but I'm not sure. Maybe someone else knows. Maybe Claudia's here.
Back question, why do we make it so complicated?
Yeah, well, okay, I understand. What we're dealing with is how to deal with, we're helping people deal with bureaucracies.
Yes.
Which create problems which they're supposed to be solving. But instead of solving them, they put up hurdles, and we're helping people over the hurdles. I accept that. I just,
you accept
never mind.
That? I don't, but that's what we okay.
You know, I see it as really an expansion of what the healthcare consumers are doing to this underserved population. And for those who finally are able to get on SSI or SSDI, they have stability, they have enough funding to be able to access a place to live. And then they're also in a good position to be able to get housing authority dollars and other related services. So it's almost like an entree point. If you can get SSI, doors open.
So the more people we can get on it, the better.
Yeah. Okay. Okay. Was that Kyle ready to say something? Or
yeah, I guess I just wanted to comment that I'm really excited to see them submit this. You know, earlier I mentioned about how difficult it is to navigate systems to get signed up for assistance. You know, we're talking about like SNAP and Medicaid and stuff. I think that doesn't even come anywhere near close comparing to just how difficult Social Security is. It's a hellish process that frankly is just, it's cruel. It's a system that you can't really navigate without having like professional expertise or, you know, professional guidance. And but it's something that is designed really for people to with no sort of offered help, unless people are going to go and get an attorney who then is going to I think 20% of the back pay maybe. So this is really incredible for them to have this, because it's such a confusing, just horrible, just hellish process.
thank you. Okay, let's keep moving. Next one, we Community Services of Northern Champaign County, Resource Connection.
All right, I think that's me.
That would be you.
So, we're pretty familiar with, in my opinion, this excellent resource for Northern Champaign County. They are only asking for a 1.5% increase, so they're asking for 68,609. You know, obviously we know over and over COVID has affected many families. Obviously Rantoul takes care of a lot of you know, folks that are in transition. They have a very large migrant population there, and so their food bank is used quite a lot. You know, due to COVID, they have many agencies that also use that office to, you know, offer assistance and things like that. But due to COVID, they haven't been able to do that. But they have been able to do some, you know, phone services and things like that on a limited basis, you know, and things like that. So, you know, again, I think it's pretty straightforward. I mean, I could throw a bunch of numbers at you, but I didn't really see anything that's a huge change this year over what we've done in the past. Again, I think they've always followed through with any questions we've asked, things like that. They're fiscally responsible, so I would be interested in offering a 2-year opportunity to them also.
Thank you. Susan, do you have anything to add to it?
I don't. They do a great job of coordinating, and this is, they have other sources of funds. So this is only a percentage of their operating costs that they're requesting. I agree with the 2-year funding if possible.
Sounds good. Thank you. Any questions or comments from anyone? Okay. So moving on to Crisis Nursery, Beyond Blue.
Okay, I think I have this one as the primary. So we have funded Beyond Blue for many years. We fund 40% of the total amount. Their other funds come from United Way, contributions, fundraising, and a DHS grant. This is a program that reaches out to mothers during the peri and postnatal time period when those who are experiencing depression related to childbirth. The purpose is to decrease the incidence of depression and to increase knowledge and reciprocal relationships between the infant and the mother. They have sought other sources of funding, and most of the funding that they request from us is personnel. They do work across communities. They work within homes. They have an emphasis on the rural population. So 50% of their participants are rural. They use an evidence-based curriculum. They have great staff credentials and experience. They do measure outcomes based on different scales that they use. And they're partnering with sistering CU and other CU agencies. So they're attempting to bring in as much resource and support for the families as possible. They've been using virtual connections because of COVID, which seems to be working for them. I would recommend a 2-year contract because again, we've been funding this for a number of years, and it's you know, crucial to prevent future social emotional concerns in children, to intervene as soon as possible. And if the mother's depressed, then this is clearly a way to not only support the mother, but also the mental health and attachment of the infant.
I'm the second reader on this, and I mean, I agree with everything that Susan said. The only thing I think I would add is, she already said it, they are reaching a lot of rural parts of Champaign County, which is great, and they're intentionally trying to do that, which is excellent. So, I mean, it's an excellent program. Again, like she said, they have great credentials. They're doing a lot of evidence-based evaluations, like ages and stages questionnaires and postpartum depression screening for the children and the women respectively. So I think it's a great program. So, yeah.
Thank you. So Julian had to step out, so we still have quorum.
Yes, I'm just going to say I need to leave. Thank you, yes. Joe. I'm sorry I have to go now.
No problem.
I'll be back in Champaign next week. I'll see you all then.
Okay, you take care. We'll see you.
Bye-bye.
Bye. So if there are no questions or comments, we'll move to the next one. And we'll probably do a few more before we call it a night, because it gets a little bit long. So Dream House will be next. Dream Big.
So this is Dream Big. They're requesting $100,000. And it's basically an expansion of the Dream Big Youth Development Program. In 2020, it expanded services to female siblings of Dream Big, but still about 75% of the applicants are female or male. There's 3 tiers. The first tier provides universal services, which include violence prevention programming, conflict resolution activities, social emotional learning and interventions, restorative practices, group-based psychotherapy. Tier 2 is targeted mentoring interventions. So it targets about 25 boys with moderate to severe behavioral challenges with one-to-one mentoring services. And then Tier 3 is intensive wraparound services. So it serves 5 to 7 families with high fidelity. So they're loyal or they're faithful in coming to the visits and having intensive services to address the mental health needs, which I assume is mostly probably going to be counseling. And then other groups in the community, such as the Don Moyer Boys and Girls Club, provide similar services, but this is just an expansion and prioritizes direct violence prevention that's not being addressed through other organizations. They use a variety of best practices and the National Evidence Informed Freedom School Model. They have a lot of people in the program that have a lot of experience, but they didn't put down like what their credentials were, such as like their degrees. And so they just had the executive director has 20 years of experience, and then the youth development and program management person has 10 years of experience, and there is a licensed social worker, but they didn't write down the other like bachelor's degree or master's degree and what. So the other thing is it didn't state how specifically rural residents will be or are being served, only how they could be. And then, again, the people that are eligible are children 5 to 13 with challenging behaviors, suspensions, ADHD, discipline referrals, those with an incarcerated parent, living in a single family household, parents living with chronic stress or low emotional or social support. They also look at other factors like low literacy skills, lack of positive male role models. Referrals are usually made by the staff of the schools, parents, and word of mouth. Usually children receive 1 year of service, but it appears the outcomes indicate participants have been engaged for 3 or more years. And then they do screening through strength and difficulties questionnaire, adverse childhood experience questionnaire, Duke emotional and social function scale, trauma screening for children and parents. And the goals are to improve mental health coping skills, anti-violence strategies, improve emotional literacy, self-regulation, decrease stress in parents, and increase support among parents. So, I think, what the application is getting towards of what they're trying to do that relates to mental health is obviously that they're providing these programs and support for families and children in an attempt to curb violence and reduce adverse childhood experiences. So, that was my take on the on the application. So, I mean, obviously, it's a good program from what I've read. The funding mainly goes to pay for the salary of the program director, so half of an FTE, an achievement coach, half an FTE, social worker, and operations coordinator, all again FTEs. And then they were awarded the Illinois COVID-19 Relief Fund grant to train wraparound facilitators, provide supplies and mentor training costs. They were also given the 21st Century Learning Community Center grant to expand youth development programming in Champaign and Rantoul. So it looks like they do have other sources of funding, but we do provide about 40% of the funds for the program.
This is Susan. I think that in the past we provided most of the funds, so I was really encouraged that they had gone out and actively competed for other funds. And it does fill a gap for children ages 5 to 13 that I think would be unmet without something like Dream House. So I everything else that John said,
Okay, thank you. Any questions or comments? I don't think any questions were raised per se, so. Okay, we'll move on. Let's see. DSC, Family Development. I think Susan was a primary reader.
Yes. So this application supports the Family Development Services staff and direct staff funding to deliver services to families with young children who are in need of early intervention services, and includes some children beyond the age of 3 up to age 5, for whom other services may not be sufficient or adequate. So it's a program that we have funded for quite a while. It's one that fulfills some of our requirement for the DD board in terms of funding those services. It's a well-designed program. It's been in existence for many years. It's home-based. They obviously went to virtual a virtual communication process due to COVID and the inability to have family and children on site or go directly into the homes. The staff are licensed and credentialed. They have master's or bachelor's degrees. It's one of those programs that I think should be under a 2-year award. We funded it for a long time. We fund 76% of the budget. They do try and get other funds from IDHS to help support it. But I can tell you that there's not enough funds in IDHS to support adequate early intervention in our community.
Thank you.
So, this is something as a pediatrician that I do all day long. So normally I refer children to early intervention that are between 0 and 3 years old who have significant developmental delay that they should be evaluated to determine if they require speech therapy, occupational therapy, physical therapy, or developmental therapy. When they get to 3 and older, then they need to go to like the Head Start and preschool to receive those services through the school district. And sometimes families are unable to either put their child in school to receive those services, or the child is in that age range but does not have enough delay. So they have to have like a 30% delay or more to receive services. So if they're 15% or 20%, like, well, you're okay, so you're enough, you should catch up by the time you get to school. Well, that doesn't always happen. And it can be difficult to catch up once you're already in school or you're in kindergarten. Then you're again, it just takes more work and more services to then catch up if you catch them later. And so really we're saving money for the community in the long term by intervening earlier, hence early intervention. But it's not cheap. Obviously, this is not a cheap service, but again, this is dollars saved for the future for the community. So I mean, that's how I see it. It's obviously a big chunk of change from our budget, but if we're able to do it, I definitely would push for funding this just because of the population it serves is some of the most at risk, and it's going to be something that we see the benefits for decades for the people in the community.
Yeah. Thank you. Any comments or questions?
Oh, I did have one question.
Yeah, go ahead.
I know from other early intervention services that are families that go to early intervention that the speech therapy has been the one that's kind of been not as well received virtually, especially for younger children. It is not easy for them to just look at a screen to do something they don't really care to do.
Yes.
Are they looking into having the therapists, especially speech therapy, I think is the biggest one to do virtually? Are they thinking about having the speech therapists come into the homes? Are they getting vaccinated so they can go into the homes? Are they planning that soon? Because that's something that a lot of families are wanting in person and not virtually. I've been sending a few kids to speech therapy at the hospital because They just don't like the virtual interaction for speech therapy for the younger children.
You got to see how the muscles work. Anybody from DSC?
Yeah, I can speak on that. So Barb Hoffman has been with us for forever and is a very, very skilled speech, language, and feeding specialist. And we really haven't encountered that with her because I think the families are so familiar with her, and what she's expressed is that she's able to coach the parents to be coaches. And so she's actually really enjoying the virtual experience, because then the parents have to get more involved, and then they can do those, reflect those things that she's teaching them after she leaves. We really haven't experienced that too much. And we're always in discussion about moving in person. We just haven't made that final decision yet, but we'll probably move to outside visits shortly.
Because I saw all of you got vaccinated a while back.
Most of us, yes.
Most of you, anyway.
It was offered.
Yes, cool. Any other questions or comments that Nicole would answer? Okay, thank you. So we'll move to the next one. So Don Moyer, see you change. So only you, John, because
oh, am I the only one on this one?
Yeah, Dr. Rappaport's
oh,
gone.
That's great. Julian's gone. Yeah. So, sorry, let me for the page. Yeah, so this is the Don Moyer Boys and Girls Club for CU Change. The request is for $100,000 to basically they serve 11 to 17-year-olds that are at risk. And they define that as reading one or more levels behind, in danger of being held back, or has repeated an academic year, attending an alternate school, has a high level of truancy, or involved in the juvenile justice system, or at risk of becoming involved in that, or the DCFS system, or having a lot of emotional behavioral stuff due to trauma. So the program is trauma informed. It's focusing on youth with minimal support systems to support them through high school graduation. They take about 40 students and will take on new students as the older ones graduate. They help them navigate the school environment, deal with peer pressure, family concerns, develop problem solving skills, graduate high school, and plan for the future. They provide program services, case management, quarterly child adolescent needs and strengths, and then family assessment needs and strengths assessments. They do intervention planning, progress reviews, family engagement activities. The staff will actually check on the child's attendance, meet with the social workers at the school, teachers, school resource officers, and parents and guardians. The programs are provided at the Don Moyer Boys and Girls Club. Some include homework assistance, education and career goal planning, coping and risky behavior prevention, positive behavior training for males, self-esteem enhancement for females. The programs are evidence-based, such as Positive Action, Project Learn, and Smart Leaders. In regards to the qualifications, they have teen services director that has a bachelor's degree in a youth development related field. Case managers have a bachelor's degree with preferred degrees in social work and counseling, but the application didn't say exactly what they have currently for those case managers, if they have those degrees or something else. Services are offered at the client's home, schools, and the local area. Transportation is provided for additional services at the Don Moyer Boys and Girls Club, such as counseling and the group sessions. CU Change works with school districts, police departments, Champaign County Youth Assessment Center, court services, and juvenile probation. Their meeting target of treatment plan clients of 50 was 50, and they had 56 in 2020. They're also meeting their treatment plan, the target treatment plan clients of 550. Wait, I'm getting that wrong. That might have been the non-TPC. But the funds go exclusively to the salary and payroll. I couldn't see in the application if there was, if they tried to find other funding for the program. So it funds 3 direct staff working with CU Change, so 2 full-time program coordinators with an annual salary of $35,700, 1 part-time supervisor at 15% full-time, and the rest of the funds go to cover FICA unemployment and staff benefits. So But yeah, I mean, that was the main question, is if they had tried to find other funding. I couldn't tell if in the summary there was any information on that. Yeah, it just says that other revenue is from contributions, but it doesn't say if they look for other like grants or other funding. So
So I don't know if Sam's still on. If Sam's on, is that a question you could answer?
Charles is also here.
Okay. Any one of them?
Yes, I'm here. Got stuck on mute.
Got it.
Okay, go ahead.
Sorry.
So
yes. So we do search for other funds, and we do use Downway Boys and Girls Club funds to try to supplement and help out the program as much as we possibly can. The overall, cost of the program is approximately about $125,000, $130,000 to run it, and we try to supplement it using our resources as much as we can.
Okay. Any other questions or comments? So we have several John Moyer's things coming up here. So we'll go to CUNC. Julian is not here, so Susan, it's you.
Yes, and I have to say from this point forward, I was not able to read the proposals that have my name with the parentheses around it because I've been gone attending to my mom's funeral and death. So I'm sorry, I think we have to hold this one for next week.
Okay. I'll put an asterisk beside it. What about Community Coalition Summer Initiatives?
Yes, I think that's mine.
Yeah.
Yeah, so this is one of the system of care priority programs that we've been funding for quite a while. It serves young people from 9 to 18 with serious emotional disturbances and multi-agency system involved youth with summer programs that Don Moyer Boys and Girls Club is the coordinator, but they subcontract out to a number of other providers. And from the description, what I've heard various things about this program at Community Coalition meetings, and it just sounds like so much fun all the time. And the list of things that they address: healthy lifestyles, academic support, structured recreation opportunities, exposure to the arts, cultural awareness, positive social skills development, and positive adult interaction. They do a lot of different things and, excuse me, reach quite a number of young people. The questions that in the past that have arisen from the board, I think have been about, well, we don't quite have a handle sometimes on exactly who is doing the subcontracting, and that has come up. And in this summary, the staff has asked that those contracts be part of the picture that we are given, so that we know so that who those groups are who are doing the subcontracting. And I think that's a reasonable request. That but the programming that they do varies in length and addresses a lot of different interests. So I think young people who wouldn't like to do one thing would find something else to do. And it's been very steady in the amount it's asked for. Maybe that could be a 2-year program. But I think mostly my question would be just for a little more detail. on what is being provided. And I suppose it changes from year to year as different programs are brought in. So I think that's all I have to say about it.
Okay, thank you. Kyle, you have anything to add?
No, I mean, it's a pretty good summary. I think we're pretty familiar with the program, and it's a pretty well-respected agency.
Okay, that's great. We kind of probably just finish up all the Boys and Girls Club. Oh, Susan, okay, we can't do that last one.
I can do it.
Oh, okay.
Yeah. Youth and Family Services is part of the system of care. We funded at 160,000, and that has been fairly level funding, or at least it is with last year. I believe that we provide 100% of the program revenue. The purpose of the program is to reduce stress in families and help them access and learn about resources. And these are families who have children with challenging behavior or mental health concerns. And they do this through a peer network. So it is a peer-to-parent or peer-to-peer support network. The peers are parents who have had experience with raising a child who has had mental health or challenging behaviors. They provide support for 35 families through this peer support program. What I would like to ask is more information about the infrastructure of the program and how many peers are involved in providing the peer support. The primary requirement for the peer support individuals is that they be 21, graduate from high school, and really have the lived experience. So I'm not looking for credentials or anything like that, but it would be helpful to know how many peer supporters are active in this program and what the supervision process is for the peer supporters. I assume that some of this has been virtual during the pandemic. And it would be also helpful if they could go beyond self-report to identify maybe a sampling of the types and number of services that families end up accessing through this peer-to-peer support program. I think it's an important program. It certainly reduces stigma. It addresses the needs of families who are under a great deal of stress. But I would like to know a little bit more about this, about the number of peer supporters and the supervision of the peer supporters.
Thank you very much.
I can answer.
Go ahead.
I can answer that. I'm Regina Kreider. I'm the director of the Alliance. And so we have 4 peer supporters in total at this time. And as far as the infrastructure for supervision, we actually do a supervision and coaching model that is an evidence-based model from the University of Maryland School of Social Work. Its acronym is called the PEARLS. And the PEARLS focus on developing the peer-based relationship with the parent. So our primary focus is when we're working with the parent. So when the peer supporter is engaging with the parent, there are certain competencies that are necessary to be present when providing that support. So like, for instance, the acronym is PEARLS. The P stands for peer-based relationship. So when we're doing the coaching and supervision, we're looking for the presence of that competency across all levels. If the peer isn't establishing that peer-based relationship, then we provide coaching and correction on how they can develop that relationship, because it's critical for the peer supporter to be able to make a connection with that peer in order to support them. And so we just utilize that model. You know, I don't know what else I could share with you that, you know, to give you more, but we do a weekly coaching and supervision model.
This is really helpful. I wasn't able to pull all of that out of the application. So thank you for the additional background.
You're welcome.
Thank you very much, Regina. Okay, so since it's getting close to 7:30 and we have a couple more things to do, we'll table the rest of the reviews till next week. We have a couple more board things to do before we call it a night, if that's okay. There's the board members think that's going to be a go.
Great idea.
Okay. Okay. So let's go ahead and wrap up with some of the last few things here. So any agency information that we have from anyone? Okay. Then we'll move on to the next thing, which would be old business. Schedules and allocations on page 174 to 177. And are there any questions about that? And I am going to be asking for a favor from the board. My son is graduating this May, and on the 19th, which is our one of our board meetings, is the honors night. It's an honors, and he's part of the honors thing. So, and I would like to be a part of it, and I'm asking to see if we can move that board meeting from the 19th to the 26th. So instead of having a May 19th meeting, to move it to the 26th of May.
I have no objection.
Y'all,
Joe, that's actually, I was going to have a problem with May the 19th as well, because I have a conference to attend out of town. So the 26th would be perfect.
Okay, that's good. That's good.
And congratulations to your son.
Oh, thank you. Thank you. He's right now at Centennial getting pictures taken, and he had to buy a suit yesterday. But if that works for everyone, or works for at least a quorum, that would be great.
Do you need a motion?
You might have to
move
check
it?
your schedules.
You need a motion, Joe?
I don't know.
Well, maybe we just need to find out from Lynn.
Yeah.
Well, I've already booked the room just in case that would work for y'all. And I wasn't even sure, like, you can have the May 19th meeting and the May 26th meeting, but I could email Julian and see if that works for him as well. But as long as those of you who are still here are okay with that change, it's fine for us.
Okay, that would be great. That I would greatly appreciate it.
So we'll cancel May 19th and move that, but we'll keep the study session on May 12th, because that's really important to me to get your reactions to our initial recommendations.
Yes, okay, that would be great.
Great.
Okay, thank you very much. And then let's see, the staff reports, we're going to defer that. Any board-to-board reports? Go ahead.
I attended the Community Coalition meeting, at which the police, various police jurisdictions talked about the recent shootings, and Tracy Parsons asked some good questions. Usually they don't get questions, but they did that time. And also saw some good presentations, I think. So I won't go on in the interest of time, but
yeah, thank
I
you
did
very
attend.
much. Thanks. And any other board announcements? I need a motion to adjourn.
I move, Susan Fowler, I move to adjourn.
You got a second?
I'll second.
Okay. Let's adjourn and have a good 166.5 hours before we see again. Okay. Have a good week. Take care.
Good night. Thank you.
Bye.
I-